Hey folks, welcome back to Transplant Helper again today. My name is Jim Merle, and today we're going to be talking about one of the most common congenital heart defects. Something that you or maybe someone you love may have dealt with. It's called Ventricular Septal Defect, or VSD for short. Now don't let that term scare you. I'm going to hopefully break it down as simply as I can, and in fact, we're going to think about a heart like a house with 4 rooms. Because once you picture it like that, it's a whole lot easier to understand. Now let's start with the basics. Imagine your heart like a house with 4 rooms, 2 upstairs and 2 downstairs. The upper rooms are actually called atria, while the lower rooms are called ventricles. Just like any well-built house, rooms have walls between them that keeps everything in the right place. But in someone with a ventricular septal defect, there's a hole in the wall between the 2 lower rooms, the ventricles. The hole lets blood pass from the left side of the heart to the right side, and it's not supposed to be that way in order to work properly at least. So why is this a problem? It's a problem because the left side of your heart is supposed to pump oxygen-rich blood out to the body, while the right side of your heart is supposed to pump oxygen-poor blood back to your lungs to pick up more oxygen. But with the VSD, some of the oxygen-rich blood from the left side leaks through the hole to the right side and goes right back in the lungs. Kind of like running your laundry through twice on a rinse cycle for absolutely no reason. Now the lungs are overloaded and the heart has to work harder than it should. Over time, this can lead to bigger problems. Problems like fluid buildup in the lungs, high blood pressure in the lungs, or even heart failure if it is not treated. So what types of symptoms do we look for, and what does it look like in everyday life? Well, not everyone with a VSD has the same symptoms, especially if the hole in the heart is very small. Some people live their entire lives without even knowing they have a problem. But when symptoms do show up, especially in babies or young children, they might include things like fast or heavy breathing, trouble feeding, poor weight gain, sweating while eating or crying, or getting tired easily. Also, you may notice a heart murmur, which is kind of a whooshing sound that a doctor can locate or notice with a stethoscope. Even in adults, if a VSD isn't caught early, you might experience things like shortness of breath or fatigue during activity. Now, here's the good news. VSDs are very, very treatable, especially when caught early. Now, let's talk about how your doctors might handle them. In the first place, they might just watch and wait. If a VSD is very small and not causing very many symptoms, a doctor might just monitor it. A lot of these small holes actually close up on their own as the child grows. It's like watching a crack on the wall kind of seal over time as the house begins to shift. Nothing fancy is needed, just patience and regular checkups. Now, secondly, they might choose to use medications. If the hole in the heart is just slightly larger, putting a strain on the heart or lungs, doctors might use medications to kind of manage the symptoms. They don't close a hole, but they can make it a lot easier on the heart to do its job in the meantime. Now, that may include medications which help to remove extra fluid, strengthen the heartbeat, or control blood pressure inside the heart. Now, in the third place, doctors may have to choose surgery or a catheter procedure. Now, if the hole in the heart is big or symptoms are serious, doctors may have to repair it. And yes, that sounds scary, but a surgery for VSD is very, 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 I use 3 varies, common and has excellent outcomes. Most often, they will use an open heart surgery to sew a patch over the hole, and in some special cases, they can even use a thin tube called a catheter to place a device in that closes the heart from the inside out without needing that open chest or open heart surgery. Either way, the goal is simple. Close the hole, take the pressure off the heart and lungs, and help the body to work in the way it's designed to. So what happens after treatment? What does life actually look like? Honestly, pretty normal. Most people, whether a hole closes on its own or is patched through a surgery, the vast majority of people are going to live full and healthy lives. There may be the occasional follow-up visit with a cardiologist, especially in more complex cases, but many people never have another issue after recovery. So let's go back to the house illustration one more time. The heart is like a house with 4 rooms, and just like any good house, the walls matter. The ventricular septal defect is just a hole between those 2 lower rooms, and thankfully, it can often be managed either through medications or ultimately requiring a surgery, which again, very successful. So if you or a child have been diagnosed with a VSD, don't panic. Take a deep breath, ask questions, and know that modern medicine has come a long way in treating this kind of condition. You're not alone.